Our brains are incredibly complex organs that control everything we do, from thinking and feeling to moving and breathing. When a brain injury occurs, it disrupts the intricate network of nerve cells, leading to a wide range of effects on the body and mind. These effects can vary greatly depending on the location and severity of the injury. Imagine the brain as a vast network of roads connecting different cities. A mild brain injury might be like a minor road closure, causing a slight detour, but not significantly disrupting traffic flow. However, a severe brain injury could be compared to a major highway shutdown, leading to widespread communication breakdowns and functional impairments. Understanding the nature and extent of brain injuries is crucial for providing appropriate medical care and support. By observing specific physical signs, such as abnormal postures or movements, medical professionals can gain valuable insights into the underlying damage within the brain. Two such signs that offer crucial information about the severity of brain injuries are decerebrate and decorticate rigidity. These conditions involve involuntary muscle stiffness and abnormal posturing, providing clues about the location and extent of damage within the brain. Decerebrate rigidity, also known as extensor posturing, is characterized by the arms and legs being held straight out, toes pointed downwards, and the head arched back. This type of rigidity often indicates damage to the brainstem, a critical area responsible for controlling vital functions like breathing, heart rate, and consciousness. On the other hand, decorticate rigidity, also known as flexor posturing, presents with the arms bent inward towards the chest, fists clenched, and legs held straight out. This posture suggests damage to areas above the brainstem, such as the cerebral hemispheres, which control higher-level functions like movement, sensation, and thought. These abnormal postures are not voluntary actions, but rather reflex responses caused by disruptions in the brain's complex motor control pathways. By carefully observing these postures, medical professionals can infer the approximate location of the injury within the brain. While both decerebrate and decorticate rigidity involve involuntary muscle stiffness, they exhibit distinct differences in posture that reflect the specific areas of the brain affected. These differences are crucial for understanding the severity and potential implications of the injury. Decerebrate rigidity, with its characteristic extension of the limbs and backward arching of the head, suggests a more severe injury involving the brainstem, the critical control center for vital functions. Damage to this area can disrupt essential bodily processes, leading to life-threatening complications. In contrast, decorticate rigidity, with its characteristic flexion of the arms and extension of the legs, typically indicates damage to areas above the brainstem, such as the cerebral hemispheres. While still serious, this type of injury may have a less immediate impact on vital functions. The distinction between these two types of rigidity highlights the importance of careful neurological assessment in determining the extent and potential consequences of brain injuries. The presence of decerebrate or decorticate rigidity provides valuable insights into the severity of a brain injury and its potential impact on recovery. While these conditions are often associated with severe injuries, it's important to remember that every individual's journey to recovery is unique. Decerebrate rigidity, due to its association with brainstem damage, is generally considered a more ominous sign, often indicating a poorer prognosis. However, advancements in medical care and rehabilitation continue to improve outcomes for individuals with even the most severe brain injuries. Decorticate rigidity, while still serious, may suggest a slightly better prognosis compared to decerebrate rigidity, as it often indicates damage to areas above the brainstem. With appropriate rehabilitation and support, individuals with decorticate rigidity can make significant strides in their recovery. It's important to approach brain injury recovery with a sense of hope and a commitment to providing comprehensive care and support. While the road to recovery may be long and challenging, ongoing research and advancements in treatment offer promising possibilities for individuals with brain injuries to regain function and improve their quality of life.